Most UK private clinics running Google Ads in 2026 are measuring the wrong thing. They are counting form submissions, phone calls, and cost per lead, and using those numbers to judge whether campaigns are working. The problem is that a form fill does not mean a patient booked. A missed call does not mean a consultation happened. And without connecting those ad clicks to what actually happens inside the clinic, you are asking Google to optimize for activity, not outcomes. In this video, I want to walk you through what offline conversion tracking is, why it matters in a healthcare context, and the 3 strategies that change how your campaigns learn. Before you build anything, there is a compliance point you cannot skip. Offline conversion tracking in healthcare means connecting a Google Click ID, a GCLID, to what happened later in the clinic. That might be a booked consultation, an attended appointment, or a treatment deposit. At that point, the data you are handling may reveal something about the care a person was seeking. Under the UK GDPR, health-related data falls under special category data. That means your privacy notice needs to be updated, your data protection officer needs to be involved, and your consent mechanism must cover downstream attribution, not just the initial inquiry. 3 risks are worth flagging before you configure anything: consent at the point of collection, GCLID retention under data minimization rules, and the attribution gaps created by Consent Mode v2 for patients who declined tracking. Here is what offline conversion tracking actually does. When a patient clicks your Google ad, Google appends a unique GCLID to the landing page URL. A hidden form field captures that ID alongside the patient's inquiry record in your practice management system, Clinico, Pabao, or whichever CRM you use. Then, when that patient attends, deposits, or converts, the outcome is recorded against their GCLID. That event is uploaded back to Google as an offline conversion. Google can now match it to the campaign, keyword, and bidding decision that generated the original click. Over time, your campaigns stop learning from basic inquiries and start optimizing around real patient outcomes. This is the loop most UK private clinics have not yet closed. For a UK private clinic, not all conversion events are equal. A form submission tells you someone expressed interest. It does not tell you whether that person ever became a patient. The data is clear here. These need to be tracked as separate conversion actions with different values in Google Ads. A raw lead, a form fill or phone call received, carries a low signal quality. A confirmed booking, where the patient has selected a date and received confirmation, is a medium-high signal. An attended appointment is your core bidding signal, the clearest proof that the ad-driven lead was genuine. And for elective procedures, the treatment deposit or PMI pre-authorization from Bupa, AXA, or Aviva carries the highest signal quality of all. Merging all of these into one generic conversion event is one of the most expensive mistakes in clinic Google Ads management. The first strategy is mapping your CRM stages to Google Ads conversion events. Before you configure anything in the platform, your CRM needs to capture and store the GCLID against every patient record. From there, you assign a conversion value to each service line based on its average commercial value. A dermatology consultation might be £120 to £250, an aesthetic procedure £250 to £450, an orthopedic consultation leading to surgery £500 to £800. These values do not need to be precise, they need to be proportionally accurate. When Google understands that one patient type is worth 3 times another, it stops treating all clicks the same. For clinics with 3 or more locations, each site should build its own offline conversion data, rather than aggregating everything into a single campaign. The second strategy addresses phone calls, which remain one of the most important inquiry channels for UK private clinics. Patients considering surgery or a clinical procedure they have never had before often want to speak to someone before they book. Form tracking alone does not capture that. UK call tracking platforms, ResponseTap, Infinity, MediaHawk, or What Converts, can connect phone inquiries back to the original ad click. But a raw call duration event is not a strong bidding signal. It includes price inquiries, missed dials, and existing patient admin. Your front-of-house team should classify every inbound call: qualified booking, price inquiry only, or non-clinical. Only the first category should be imported into Google Ads as a conversion. The data will show fewer conversions initially. That is intentional. You are removing noise so Google learns from the calls that actually produce patients. Once offline conversion events are flowing with assigned values, you can move to value-based bidding. This is where Target ROAS becomes useful. Rather than asking Google to bring in as many conversions as possible, you ask it to optimize toward a specific return on ad spend based on the value of the patient outcomes it is pursuing. A UK aesthetic clinic with a £35 median CPA and an average treatment value of £350 could set a target ROAS of 1,000%, telling Google to aim for £10 in treatment value for every £1 spent. The setup requires volume to stabilize. Google generally needs at least 50 conversions per campaign per month before smart bidding becomes reliable. For lower volume service lines, group similar services first, accumulate sufficient data, and separate into individual campaigns once the threshold is met. It is worth understanding the difference between offline conversion tracking and the related approaches your account may already be using. Standard online conversion tracking, form fills and call clicks is a baseline that all clinics should have. Enhanced conversions improve attribution across devices using hashed email or phone data, but they do not improve the quality of the outcome. Raw call conversions based on duration include noise. Qualified call conversions, classified by your reception team as genuine bookings, are a strong signal. And offline conversion import, tracking attended appointments, treatment deposits, and PMI authorizations, is the gold standard. It is what enables Target ROAS to function as it should, and it gives your reporting a number that actually matters, the real cost of acquiring a patient. There is one final layer that sits alongside all of this. Healthcare advertising sits in the YMYL category, your money or your life, because the information a patient sees can influence real decisions about their health. Google applies higher scrutiny to healthcare campaigns. Your landing pages need to show clear trust signals, named clinicians with GMC, GDC, or HCPC registration numbers, transparent pricing, CQC references where relevant, and patient pathways that reflect your actual clinic. For technical setup, add medical organization and local business schema to your main site pages. Align your event naming across Google Ads, GA4, and your CRM, using the same patient milestones of booked consultation, attended appointment, and completed treatment, and confirm that Consent Mode V2 is configured correctly across every landing page. If you are not sure where your clinic stands on any of this, whether your CRM is capturing GCLIDs correctly, whether your call outcomes are being classified and imported, or whether your bidding is optimizing on attended appointments rather than raw inquiries, UpMedico offers a free initial consultation. We work exclusively with UK and Irish private clinics, and everything we look at is specific to private healthcare.